Our first speaker is Dr. Roseanne Dobkin. She is a licensed psychologist who has 15 years of clinical work and research in Parkinson's mental health. In her studies, she has examined the interactions between physical and mental health in Parkinson's. She also looks at the impact of their intricate associations on quality of life and functional disability. Dr. Dobkin completed her PhD in clinical psychology at the Medical College of Pennsylvania Hahnemann University in 2002 and a postdoctoral fellowship in clinical psychopharmacology at Robert Wood Johnson's Medical School. She's been conducting mental health research in Parkinson's disease for 13 years. To date, her research has addressed the efficacy of face-to-face cognitive behavioral treatment for depression in PD in a randomized controlled trial and the developments and pilot testing of telephone-based CBT, or cognitive behavioral treatment. She has systematically examined barriers to mental health care utilization in PD and the use of telemedicine to leverage access to specialized mental health care in the PD community. Dr. Dobkin is also a practicing psychologist and the mental health lead for the University of Delaware's Parkinson's Disease Telemedicine Clinic. Her prior work has been funded by the National Institutes of Health and the Patterson Trust Awards Program in Clinical Research. Welcome, Dr. Dobkin.
Thank you so much for having me. It's really my honor and my privilege to be here with you this morning and to talk about, cognitive changes and challenges in Parkinson's disease and what we can do about them. I hope to take this very daunting topic and turn it on its head in order to put everybody who's listening in the driver's seat so they can go out there and take charge and continue to live life to the fullest. Just getting by is not good enough. I don't accept that as your reality, and I don't want you to accept that either. Knowledge equals power. So on that note, we're going to spend some time this morning talking about common changes and challenges and what we can do about them today to start living the best life possible. Okay, so let me see how my little remote clicker is going to work for me to advance my slides. Okay, here we go. So what can I tell you about cognitive changes in Parkinson's disease? Well, as everybody knows, Parkinson's disease is not just a movement disorder, but the overwhelming majority of people living with Parkinson's also experience non-motor or neuropsychiatric complications, things like depression and anxiety, sleep disturbance, and changes in cognition. These are all common and important symptoms. With respect to cognitive changes, we know that about up to 30% of people with Parkinson's have already noticed cognitive changes at the time of their diagnosis. And these changes are heterogeneous with respect to the aspects of cognition that are affected, as well as the order in which they are affected. Just like we've heard people say, if you've met one person with Parkinson's, you've met one person with Parkinson's. Everybody is very different in their symptom presentation, and that also applies to cognitive symptoms and cognitive changes and challenges. So with respect to common areas of cognition that may be affected, individuals may experience change with their memory, with executive functions. And when I say executive functions, I mean things like planning and problem solving, visual spatial skills, which refers to the ability to judge distances or to read a map. Attention can be affected, as well as language and processing speed. These cognitive changes that individuals experience occur on a continuum that ranges from normal aging to mild cognitive impairment to full-blown dementia. Where an individual falls on the continuum really depends on how many different aspects of cognition are affected, the extent to which those areas of cognition are affected, and how severely those changes in cognition impact their day-to-day functioning. So, for example, it's probably expected and pretty common for individuals to maybe forget names or to have difficulty with word finding as they age and get older. That might be a milder presentation of a cognitive fluctuation or cognitive impairment. If an individual were to get lost on a walk in their own neighborhood, that might be an example of a more extreme form of impairment. So again, we all experience changes as we age. Cognitive changes are not specific just to Parkinson's disease, but Parkinson's can magnify some of these normal changes that we all experience as we grow older. And again, depending on the number of changes that an individual is experiencing and the extent to which those changes get in the way, make life harder, that helps to determine where an individual may fall on this continuum that you see on this slide. Okay. So not only are different areas of cognition potentially affected in Parkinson's disease, the way in which these symptoms cluster together may also vary person to person. And research has suggested that there may be some distinct cognitive symptom profiles that emerge in Parkinson's. The first is called the frontal executive. So these individuals have more difficulty with the planning and problem solving and strategizing that I mentioned earlier. And these types of cognitive symptom profiles tend to be associated with a younger age of onset, more dopamine depletion in the frontal striatal areas. These folks tend to respond very well to dopaminergic replacement therapy, and individuals who present with more difficulties in the frontal executive area tend to have a lower risk of going on to have a diagnosis of dementia. There's also a profile that's characterized more by difficulties with memory or with those visual spatial skills. These types of cognitive symptoms and profiles tend to be associated with older age in general, older age at the time of Parkinson's diagnosis, as well as individuals who have poorer response to medication and more difficulties with balance and walking. Individuals who present more with these memory and visual spatial difficulties versus the frontal executive types of difficulties do tend to have a higher risk of progressing to dementia. And I'm sure it goes without saying that all of these changes and challenges are associated with significant negative consequences, not only for people living with Parkinson's disease, but also for their family members. We know that cognitive changes in Parkinson's disease are associated with decreased independence, greater difficulties with medication adherence, diminished quality of life, poor treatment outcomes in general, increased depression and anxiety, certainly care partner burden, and also a range of safety issues. So for all of these reasons, it's important to figure out how we can best intervene and manage these cognitive symptoms in order to improve quality of life, as well as other global Parkinson's disease outcomes. So this slide outlines contributing risk factors for cognitive impairment in Parkinson's disease. And the reason why I want to talk about risk is because risk gives us an opportunity for intervention. If we understand what risk factors are, then we can also begin to think through lifestyle changes and interventions that can be implemented in order to address those risk factors for cognitive impairment. And as you can see, there are several different risk factors listed on this slide. I will say up front that risk does not imply causation. So these are factors that are associated with elevated rates of cognitive impairment in Parkinson's disease, but they do not cause, per se, cognitive impairment. We just know there's a high level of association. So just to quickly review what some of the risk factors are, they include things like older age, longer duration of Parkinson's, having some cognitive impairment prior to the diagnosis of Parkinson's disease, other medical comorbidities, individuals who have Parkinson's that presents earlier on with difficulties with balance and walking and gait tend to have a higher risk for cognitive difficulties, as well as those who have a sleep disorder known as RBD, in which individuals act out their dreams. Individuals who have more severe motor symptoms, higher rates of depression and anxiety, sleepiness during the day, and those who are socially isolated also have a higher risk for cognitive impairment. What I want to point out, and I use the color red because red's my favorite color, so I'll just put out there right now, but I have these risk factors color-coded on the slide. Some are in dark red, and some are in a lighter shade of red. And what I want to emphasize is that everything that is hopefully jumping off the screen at you right now in the dark red, these are all potentially modifiable factors, or more modifiable than the other factors. These are the areas where we can begin to intervene and take control and develop an arsenal of tools, an arsenal of coping skills that we can begin to use today in order to enhance our cognitive health, in order to improve our quality of life, and the meaning and the joy and the satisfaction that we can get out of every single day. So I really want to just pause there and have us focus on that we have control. Yes, Parkinson's is associated with a higher risk for cognitive impairment, but that does not mean that we can't do things starting right now to optimize our cognitive health. And this is another visual representation of many of the areas that we can impact in order to really enhance our cognitive health. And as you can see, when we put all of these slices together, it forms a complete picture. It really, in many ways, puts the entire world in our hands, because if we can work to manage overall risk factors like motor severity, by exercise, by taking our medication on time, every time, by engaging in all of the multidisciplinary services that are recommended, like PT and OT. If we work to get issues like depression and anxiety under control, if we have a healthy diet and we really prioritize our self-care, we can really make a difference with respect to the cognitive effects of the disease process. Okay. So let's talk a little bit more about how to do that. Because again, I want to not only set the stage regarding the types of changes and challenges that individuals may experience related to thinking and cognition in the context of Parkinson's disease, but more importantly, what we can do to take control, to be empowered, to enhance our health in every way possible so we can live the best possible life with Parkinson's disease. So how do we do that? Well, I think the conversation really starts with what are some non-pharmacological interventions for cognitive health? So there are several. What I'm going to focus on the rest of this morning are non-pharmacological interventions such as exercise, nutrition, cognitive training, and mood enhancement. And what's great, in my opinion, about all of these interventions is that not only might they have a direct impact on those cognitive skills, like memory and executive functioning, but they may also have a direct impact on many of the risk factors for cognitive impairment, like depression and anxiety and level of physical disability. So all of these interventions that we're going to talk about may directly impact our cognitive abilities and may also indirectly enhance them by their effects on other areas that are related to cognition. So I'm going to start my discussion here related to the golden nugget of exercise. I'm sure everybody has heard about the benefits of exercise, for mental health, for managing, physical concerns associated with Parkinson's disease. But I really want to emphasize that here is yet another area in which exercise can be incredibly beneficial. Exercise is probably one of the most studied non-pharmacological interventions for cognitive health. Not only does exercise directly impact cognitive skills like memory and executive function, which we'll talk about in a moment, but it can also have a really positive impact on motor severity, depression and anxiety, how fatigued we feel during the day, and if we're exercising with other people, if we're exercising outside of the house, it can also help to decrease feelings of social isolation, and that's so critically important. I think we can all relate in a very real way to how intense feelings of social isolation can be, especially given the pandemic that we've been living through the past year or so. And exercising outdoors, exercising virtually with other members of your community can really help to decrease those feelings of isolation. So exercise is a really powerful therapeutic technique for so many reasons and on so many levels. So why does exercise help with cognition? Well, I just mentioned a moment ago all the ways in which exercise may influence some of the other risk factors for cognitive challenges, but exercise may also directly enhance cognition through its very positive effects on neurobiology and physiology. Studies have shown that exercise is related to improvements in the cognitive areas of attention, processing speed, executive function, memory, and spatial cognition. Okay, so this is, again, exercise is casting a really wide net in terms of its ability to have a very strong, very real, very direct, potent impact on our ability to think, to pay attention, to remember, and to process what's going on in the world around us. So if you didn't already know that exercise was really beneficial for Parkinson's, now we have even more data to suggest that everybody needs to get up and move. So in terms of exercise, various types of exercise have been studied. I often get the question, well, Dr. Dobkin, what's the best type of exercise? So my clinical answer is any type of exercise that you do that you are safe and comfortable engaging in is the right type of exercise. In terms of what the research shows, certainly aerobic exercise, strength training, and their combination have been the most widely studied. When individuals have done studies called meta-analyses, where they look at all of the results, across several different research programs pooled together, what they have found is that significant improvements in cognition were observed when individuals engaged in about 150 minutes of moderate intensity physical activity per week for 6 months, and that these benefits persisted even after 18 months. So 150 minutes seems to be the key number. So if we do a little bit of, back of the envelope math, that's about 5 days a week, 30 minutes each of moderate intensity cardiovascular physical activity. Some studies show differences in as little as 6 weeks. So, aerobic exercise, walking, cycling on an exercise bike, rock steady boxing. These are all things that can get your heart rate up and can really enhance cognitive abilities over time. It doesn't have to be anything fancy. A brisk walk around the neighborhood. And if you can't go out and walk around the neighborhood, chair exercises where you're doing a lot of movements with your arms over your head and you're raising your heart rate. All of that matters, but it is important to move. And it is important to move in a structured way. in order to engage in that exercise routine. I've had people tell me, oh, Dr. Dobkin, I exercise. And I'll say, oh, okay, great, wonderful. Tell me about it. I want to hear, what's your daily routine? And I'll share it with other people. And I may have somebody come back to me and say, well, I walk out to the mailbox every day and I get my mail and then I come back in and I sit back down in front of the TV. Well, that's physical activity. And of course, we want to move more than we want to be sedentary, but that's not exercise. Exercise is something that's sustained for a period of time that increases your heart rate and hopefully is fun and enjoyable and keeps you coming back for more. But again, I want everybody to think cardio is very beneficial, and I want you to think 150 minutes a week. So it can be as simple as 30 minutes, 5 days per week. And it doesn't have to be fancy, but I also don't want you guys to call it in. If it's too easy, if you can plan your dinner menu and talk to a friend and do your nails at the same time, you're probably not working hard enough. So there needs to be some effort involved, but of course we want to do everything safely. So everybody can think about how they're going to go out and exercise after this wonderful symposium this morning. So a little bit more about what some of the research studies in this space have shown. So aerobic exercise, which I just spent a few moments talking about, has been clearly linked to improvements in executive skills. And again, executive skills is this fancy term, but we're talking about things like planning and problem solving and strategizing. Some studies have found effects with individuals walking, 45 minutes 3 times a week over a period of 6 months. There's also been some research that's looked at strength training, so doing weight-bearing exercises or, using hand weights, and individuals doing resistance training twice a week for 24 months, they were observed to experience improvements with memory, executive skills, and their ability to pay attention. There's also been some neat studies that have looked at tango and dance in Parkinson's disease and have found nice improvements with spatial skills and spatial cognitions. In fact, a dance group exercise program that met 90 minutes twice a week for 12 weeks was very positively related to improvements in this area of spatial cognition. So as you can see, from looking at the slide, there's really something for everybody. If it's aerobic, if it's strength training, if it's dance. There's also been some studies that I don't have listed on the slide looking at yoga and even sustained practice of diaphragmatic breathing or other types of meditations. All of those types of interventions do make a difference over time, but we have to stick with it and we have to have fun along the way. If we don't enjoy doing it, it's going to be really hard to make it part of the regular routine and to go out and to do it every day. So we have to find something that's enjoyable, but we have to move and we have to get our heart rate up and we have to do it consistently. If it were up to me, I would love all of the wonderful people with Parkinson's that I work with to exercise an hour a day, doing whatever you love. I know an hour a day is not always possible or feasible. I know sometimes life gets in the way. So if you can't do an hour a day, again, I'm going to come back to 150 minutes a week, 30 minutes, 5 times a week. So now shifting gears a little bit, I'm going to speak about nutrition. This is also a really important aspect of our day where we have some control, where we can be empowered, where we can make some healthier choices and maybe make fewer unhealthy choices. In addition to some preliminary research showing that the food that we eat and the supplements that we put in our body, those choices may directly impact our thinking skills, but they can also influence the amount of physical impairment that we experience. There's some really compelling research that's starting to show that nutrition can be related to depression and anxiety and to improvements in those domains. And it can certainly affect, how tired or fatigued we feel during the day. If we are, enjoying healthy meals with others, that is going to decrease social isolation And I don't have it listed here on this slide, but the other modifiable risk factor that nutrition is very much associated with is exercise. If we eat well, we have the strength and the energy that we need to go out and do the best possible job with those workouts. Because again, we don't want to call it in. We really want to give it all that we have and, try our very best to get a good workout in. And if we are fueling our bodies appropriately, it's going to be a lot easier to go and work out without feeling like we may pass out or become lightheaded. So we really need to think about nutrition and what we are putting in our bodies, because that's a decision that we probably all make, 3 to 5 times a day, and we want to make that choice wisely. So what do we know about nutrition and cognitive health? Well, there's certainly, growing interest in this area and the relationship between nutrition and cognition. A lot of research has explored, the brain-gut connection, the importance of the microbiome and macronutrients. We know that nutrition may have a positive impact on inflammation and neurodegeneration. And there have been several studies in non-Parkinson's populations which suggest that foods like blueberries and cocoa, pure dark chocolate, not the processed kind that's loaded with sugar, and tea and red wine may actually protect against cognitive decline. So I'm not suggesting that, we go on a red wine and dark chocolate diet, but we do want to be mindful of the fact that what we put into our mouths each day can really make a difference with respect to how we think, how we feel, and how we function. So what do we know about specific nutrients and their role in Parkinson's disease? So there have been some studies that have looked more closely at nutrients that may have a relationship to both increased or decreased risk of Parkinson's. So dairy, unfortunately for my dairy lovers out there, has been an identified culprit. Dairy is associated with increased risk of Parkinson's and potentially more cognitive difficulties as well. On the other hand, and this might not come as a surprise, fruits, vegetables, fish, and even caffeine have, in limited, moderate amounts, have been associated. And there's also some research on nutritional supplements like the B vitamins and folate that may convey some cognitive benefit. In addition, there are some specific diets that focus on the combination of these foods that may have a beneficial impact on cognition as well. And I'm going to talk a little bit more about a diet called the MIND diet, which combines key aspects of a diet you may be familiar with known as the Mediterranean diet with a diet known as DASH that has been investigated for individuals who have been dealing with hypertension and issues with high blood pressure. So the MIND diet really takes elements of the Mediterranean diet, which focuses on a lot of the green leafy vegetables and the healthy fats like avocado and olive oil, and it takes components of the DASH intervention, which focuses on healthy grains and complex carbs like quinoa and brown rice, and it brings them together in a way to create a program to optimize brain health. Okay, so this is the MIND diet. So within the context of the MIND diet, there are certain foods that are really emphasized that we encourage individuals to eat more of because not only are they good for you in general, but they may be really good for global Parkinson's outcomes in addition to cognitive skills. So what are the 10 brain healthy foods that we really want to focus on? So again, not a surprise, green leafy vegetables, any vegetable. I'm never going to tell you don't eat your vegetables, nuts. And when it comes to nuts, raw nuts are better than nuts that are roasted in potentially unhealthy oils. Berries are very healthy, blueberries in particular, raspberries, blackberries, beans and legumes, whole grains. So when I'm talking about whole grains, I don't mean anything that's processed or made with traditional white flour. An Oreo is not considered a whole grain, but steel-cut oatmeal or brown rice would probably go a long way towards meeting the definition of a whole grain. Seafood is really healthy. Poultry, trying to utilize, olive oil versus, let's say, a more highly processed vegetable oil, and a little bit of wine can also be healthy. The Mind Diet also outlines 5 unhealthy foods for brain health. So we know what the healthy foods are. What are some of the unhealthy foods? Unhealthy foods include things like butter or like that heavily processed stick margarine, a lot of red meat, cheese, pastries and sweets, and fried and fast food. And I would never suggest to anybody that you should 100% eliminate these foods forever, but we want to eat anything that's in this red column in moderation. So limiting red meat, limiting the sweets or the fried foods to maybe once or twice a week if you need to have them at all. And when it comes to making healthy nutritional changes, we don't want to go to extremes. It does not have to be all or nothing, because I think everybody can probably relate to the fact that if we try to do something in the extreme, it's very hard to keep up with it for a reasonable period of time. And in order for these interventions to be helpful, to be beneficial, to enhance our cognitive health, we want to make them a way of life. We want to incorporate them into our day-to-day. If we're doing anything that's too extreme or really just a huge deviation from our established patterns, it's going to be pretty difficult to keep up with them. So we want to start with making easy changes. So maybe we start with having a salad with lunch and dinner, or we puree some vegetables to make an easy soup that you can sip on during the day as a snack. Maybe you swap out Frosted Flakes and, you replace them with oatmeal in the morning. Maybe you add in seafood for dinner once or twice a week instead of having beef every single night. So make 1 or 2 changes and then take it from there. It doesn't have to be a major overhaul of the day-to-day, but we want to make changes that are reasonable and achievable and that you can keep up with in the long run. And that applies to exercise changes as well as to changes related to nutrition or any other type of healthy lifestyle change that you're thinking about making. You want to start low and go slow so you can maintain that healthy change over time. And the reality is some research shows that if we eat in this healthier way about 80% of the time, we can still achieve notable gains and notable benefits with respect to our cognition. So again, it doesn't have to be all or nothing. Pick one thing and experiment with it, see what it feels like, and then move on from there. So as you all look at this list, you can think about, after our talk, you're going to go exercise, and then you're going to go make a healthy snack, pulling from some of the ingredients that you see listed on this slide. So just to provide a little bit more data behind some of the recommendations that I shared, in one study, this Mind Diet that we've been talking about was associated over time with a 54% reduction in the risk for Alzheimer's. And this next statement is in quotes. It says, the difference in rates was the equivalent of being 7.5 years younger in age. So to restate that fact, individuals who followed the Mind Diet versus those who did not, over time, the differences that were observed in their cognitive skills and thinking abilities was the equivalent of being 7.5 years younger. If you could bottle this and sell it, do you know how much money that would go for? So anything that we can do to preserve our cognitive health and to enhance it over time is certainly worth doing. And many, many of these dietary changes seem like they're quite promising in that regard. And then another quote from this research study, the Mind Diet score was statistically significantly associated with each cognitive domain particularly for episodic memory, semantic memory, and perceptual speed. So what this means is that these dietary changes didn't just impact one aspect of thinking and cognition, but actually had a really nice, really beneficial impact on many, many aspects. Okay? So what we do and what we put into our mouth, what's part of our daily lifestyle, can really make a big difference. How we think, how we feel, how we function, and how we're able to enjoy the best possible quality of life. So these are so many things that we just kind of maybe take for granted or we don't think about, but we want to start thinking about them because they make a difference. So now I'm going to talk a little bit about cognitive training. And again, in addition to directly impacting cognitive skills, and I'll share some research in that area in a moment, when we do cognitive training, and by cognitive training, I mean brain games and puzzles and mazes and other types of cognitive exercises, we can also indirectly affect concerns like depression and anxiety, how fatigued we feel, and enhance overall aspects of our mood. And there's a lot of research that has been going on with respect to the beneficial impact that these games and puzzles and word searches may have on all of our cognitive skills. So cognitive training is based on the idea that our cognitive functions, our problem solving, our memory, our language skills can be strengthened over time with practice. And cognitive training has been directly related to improvements in neuroplasticity and neurogenesis in the brain. It's kind of like weightlifting for your brain. So cognitive training is really referring to specific brain exercises and targeted practice. Again, crossword puzzles, Sudoku, trying to remember lists of words. There are online cognitive training platforms like Luminosity, or I think there's one that's called Happy Neuron that people really like. It's targeted practice for your brain, just like lifting weights may be targeted practice for your biceps or your triceps or your pectorals. And in general, cognitive training, participating in activities that expose an individual to the games and the puzzles and the mazes have been led to improvements in executive functioning and working memory and processing speed. And I'm going to break this down for you in a moment. Okay. So again, some examples of cognitive training. Word search tasks, matrices, puzzles, speech therapy, and a lot of the exercises that individuals are asked to do when they go in for something like the LOUD program. It also really taps into a lot of these cognitive skills and domains. Picture completion, storytelling, I mentioned Sudoku, sitting down and playing cards with your grandkids, or playing Clue or any type of strategy game, that's going to enhance your cognitive skills. And all of these types of training programs and paradigms have been associated with improvements in executive functioning. Something else that's not on the slide, but is also really, really important for cognition, having a conversation with other people. When you're engaged in conversation and you're speaking with others, you have to be thinking because you have to be listening and processing and understanding, making sense of what you're hearing, formulating a response, and then finding a way to express that response. So engaging in conversation rather than being isolated and alone can also really enhance cognition. So again, many of the simple things that we do day in and day out that we take for granted can really positively impact our cognitive health. So what we want to do is we want to approach some of these day-to-day activities with concerted focus and effort. Be deliberate in the choices that we make with respect to exercise. Be deliberate in the choices that we make with respect to what we put on our plate and what we eat. Be deliberate to how engaged we are in our day-to-day activities and in our conversations with other people. If we're playing with our grandkids, if we're having a conversation with our neighbor, we are using our cognitive skills and they will become stronger over time. It doesn't have to be fancy. It just has to happen. And I can't overstate that fact. So again, look at everything on this slide and see, which of the things listed might you be able to do a little bit of later today? Do you have a crossword puzzle from the New York Times that's sitting on a coffee table that maybe you can get to? Do you have a friend that you can place a call to and have a 5-minute conversation about this seminar and what you learned? Are you visiting a grandchild and maybe you can share a story about a favorite vacation that you took 20 years ago? All of these simple day-to-day things can really make a huge improvement in our cognitive health. So now I'm going to talk about a topic where the rubber really hits the road, mood enhancement. We know that concerns like depression and anxiety can further intensify and exacerbate the cognitive changes and challenges that individuals may experience. So when we can work to get our mood under better control, not only do we feel better because we're less depressed and anxious, but we're also reducing our risk of cognitive difficulties over time. We also know in Parkinson's that when we can get mood under control, that has a positive impact on our overall level of physical disability. It has an overall effect on how fatigued or sleepy we feel during the day. And when our mood is better, we're more likely to be proactively engaged in our self-care, which means we may follow up with that referral for PT or OT or speech. We're going to attend that Rocksteady boxing class. Maybe we'll decide, to go to the local farmer's market and buy some fresh vegetables to make a salad for lunch. When our mood is optimal, we can do all of the things that are also good for our physical health and our cognitive health with greater ease and with greater frequency. And as a clinical psychologist that spends a lot of time working with people to develop strategies and tools that they can use to take control over negative feelings like depression and anxiety, so those negative feelings don't take control over them, I cannot overstate the importance of working to optimize mood, because it's helpful in its own right, and it's also really helpful for cognitive skills and for engaging in that strength training work with our mind. So as I mentioned earlier, emotional concerns like anxiety, depression, sleep, and fatigue, they can mirror symptoms of cognitive challenges. They have symptoms of, concentration problems and memory deficits associated with their presence. So they're really going to exacerbate or throw fuel on the fire with respect to the other cognitive difficulties that you may already be experiencing. And if we can treat mood simultaneously, we can address associated cognitive symptoms. And there are so many effective treatments that exist for depression and anxiety. There's absolutely no reason to suffer in silence. So I'm going to spend a few moments talking about a type of work that I do, which is called cognitive behavioral therapy. And just to set the stage, cognitive behavioral therapy is based on the premise that there are multiple interacting causal factors that are related to the onset and maintenance of concerns like depression and anxiety. So we certainly know that there are biological factors that are implicated in the onset of mood disturbances. But in addition to those biological factors, there are also cognitive factors and there are behavioral factors. And when I say cognitive in this context refers to how we are thinking about ourselves, how we are thinking about our world, how we are thinking about our future. When we have overly negative, unrealistic, pessimistic views of ourselves and our world and our future, we tend to be more depressed. We tend to be more anxious. And what we're doing or not doing in the course of our day also makes a really big difference with respect to how we're feeling. When we don't have enough exposure to the people, places, and things that enable us to derive meaning and reward and satisfaction from our environment, that can have a really negative impact on our mood as well. So when we intervene in these two bubbles, when we work to take negative thoughts and press pause on them and try to balance them out and replay them in a healthier, more adaptive direction. That can improve our mood and then indirectly can also improve our cognition. When we engage in more activities that enable us to feel good about ourselves, that enable us to experience pleasure or satisfaction in the day, that can also enhance our mood and then go on to enhance our cognitive and thinking abilities as well. And I'm going to share some examples of how we can do these things with you coming up next. So how can we do this? If we want to work non-pharmacologically to enhance our mood, to reduce depression and to reduce anxiety, to improve our mental health and to improve our cognitive health, what do we want to think about? We'll think about how can we increase our engagement, our involvement in meaningful and social activities in the context of a given day. And when I say meaningful and social activities, I don't necessarily want people to think about doing more, but I want you to think about doing smart. How can we sprinkle in the opportunity for joy and satisfaction in our day? Maybe it means we call a friend. Maybe it means we respond to email the day that it comes in rather than a week later or not at all. Maybe we invite a friend for a cup of coffee or a glass of wine outside. Maybe we say yes when our neighbor says, do you want to go for a walk? Versus saying, no, thank you, not today. But we need to have enough meaning and pleasure in each and every day in order to feel good, in order to feel satisfied, in order to feel like we are productive and engaged with our world and with those around us. So I usually suggest to the people that I work with, let's try to set 3 goals each day to guide what we do. I'm sure it's not going to be a surprise when I tell you that the first goal is usually an exercise goal. I love all of the clients I work with to have 1 exercise goal per day, 1 social goal, and something else that's just for fun. Maybe it's watching your favorite Netflix series at night or listening to your favorite Billy Joel or Elton John CD, or engaging in your artwork or your music, something that's meaningful and satisfying and rewarding to you. In order to do that, sometimes we have to problem solve around physical limitations, and that's okay. It doesn't have to be all or nothing. You might not be able to go outside and walk for 60 minutes, but maybe you can walk for 15 minutes. You might not be able to stand up in the kitchen for an hour to cook your favorite dinner, but maybe you could sit down at the kitchen table and chop up vegetables and then prepare the meal with your loved one. So how can we problem solve around our physical limitations in order to more fully engage in our life? It's really important to think about how we can reduce our overall level of stress and anxiety during the day. Breathing exercises, meditations, guided visualizations can be really helpful in this regard. Having a consistent sleep schedule is also really important. So when I say sleep schedule, what do I mean by that? I mean, in general, going to bed and getting up about the same time, give or take 30 minutes. Trying to avoid overly stimulating activities late at night. So it's probably not a good idea to get in bed and then get on the phone with your in-laws and discuss something very controversial, or bring your laptop to bed and try to figure out TurboTax and how you're going to get that tax return done on time. We want to do soothing, relaxing things before bed. We want to maintain rhythm and schedule to the day. We want to avoid long, excessive naps during the day. A 30 or 60-minute nap early in the afternoon, if you're really tired, is probably not going to have a huge negative impact on your nighttime sleep, but sleeping 3 or 4 hours each afternoon very much might. So we really want to make sure that we're limiting, excessive napping during the day. We're maintaining a consistent sleep and wake routine, and we're avoiding overly stimulating activities right before bed, as well as caffeine very late in the day, and also a lot of alcohol very late in the day, because what happens with alcohol is you may fall asleep very quickly, but then a few hours later you will be up and you'll be wide awake, and it can make it really difficult to get back to sleep. The other key intervention that I alluded to earlier, and I will mention again here, is really staying on top of our thoughts. We are always talking to ourselves all of the time. Most of us don't stop to really think about the fact that we're talking to ourselves or to really focus on what we're saying to ourselves, unless you have somebody like me that says, what's running through your mind right now? But we're constantly making meaning and interpreting what's going on around us. Sometimes those thoughts, those meanings, those interpretations are based more on fear rather than on the facts of the situation. And it can be really difficult to have good quality of life when we're being weighed down by our negative thoughts. It can be really difficult to think clearly and to be an effective problem solver when we're being weighed down by thoughts that may be irrational or out of proportion to the situation. So it can be really helpful to get into the practice of being aware of our thinking and learning how to identify negative thoughts when we're having them. Press pause on those thoughts and then hopefully look at the thought more closely so we can rewind the thought and then replay it in a healthier way, in a way that's more adaptive, in a way that's more beneficial. I'm going to share a story with you with permission. And I think listening to the story really drives home the message of how important our thoughts are with respect to how we are thinking and how we are feeling. Because Parkinson's is difficult enough to live with day in and day out. And when we have excessively skewed negative thoughts about what we're going through and what we're experiencing and our ability to cope effectively with what we're feeling and experiencing, it makes a difficult situation pretty unbearable. So we want to look closely at what we're thinking and saying to ourselves so that we can relieve some of this undue burden that our thoughts may be causing for us from time to time. So I'm going to share a story with you with permission from my friend Bill. And Bill is a gentleman with Parkinson's disease that I've known for well over 20 years at this point. And this example stems from a therapy session that I had with Bill, probably going back 15 years ago. And Bill and I had been meeting weekly to do cognitive behavioral therapy to address some of the depressive symptoms that he was experiencing. And he came in to his session one Thursday morning at 10 a.m. and he was looking particularly sad and despondent. So I immediately picked up on that and I asked him to share with me, what was running through his mind and what was related to him feeling, so down and out in that moment. And he looked at me and he said, Roseanne, he's like, I am helpless. He's like, I never thought I would sit here and say this to you. He's like, but I am really a helpless human being. And I said, oh my goodness, well, tell me what happened. What has you thinking along those lines and labeling yourself in such a negative way as helpless? So he took me back to some events that had occurred the night before. And again, this is going back, I want to say, I said 15 years, but probably, 15 years is right. So 2004, 2005. And the reason why I am really putting a timestamp on this is because back when Bill was sharing the story, we were not all as attached to our cell phones as we are in this current day and age. So this will make the analogy that he shared, I think, really take on additional significance. So he's sharing the story, and he was saying, I woke up at 3 o'clock in the morning last night, like I always do, because I had to go to the bathroom. So I got up to go to the bathroom and I was washing my hands and I was about ready to go back to the bedroom and I was frozen. I was stuck. I couldn't move my feet and I'm standing there barefoot on the cold tile in the bathroom floor and I was 100% helpless and I never felt so demoralized. And I said, oh my gosh, that must have been really difficult for you. Tell me what happened next. And he's like, well, I told you, Roseanne. He's like, I was just incredibly helpless. I was standing there, cold bathroom tile, and I couldn't move my feet. How else could I possibly think about myself? And I said, okay, Bill, well, that was 3 a.m. Like now it's 10 a.m. and you're in my office. Some things must have happened over the past 7 hours. So tell me how you got yourself from your bathroom to my couch. And he said, well, I've been having all these difficulties with my meds, and I've been really freezing a lot, so I don't go anywhere without my cell phone. This was back in 2004, 2005. He's wearing his cell phone around his neck. I said, okay, so what did you do? And he said, well, I used my phone, and he's like, I called my wife on the house phone, which was right by the bed where she was sleeping, and I woke her up, and she came into the hall bathroom where I was, and she helped me to practice. She coached me. She cued me. We practiced some of my PT exercises that I had learned with respect to how to break the freeze. And I was able to move again, and I got myself back in bed. So as we talked through that situation, Bill was able to recognize that even though he physically could not move his feet, he was not helpless, because he was a planner, he was a problem solver, he had his phone, he called his wife, and he helped himself out of the situation, even though his immediate response to helping himself was not necessarily the movement of his feet. It was calling his wife, working through PT, and then getting back to bed. So by looking more closely at that thought, I'm helpless, and then replaying it in a more balanced way, such that the thought was reframed as, even though I was unable to move my feet in that situation, I was not helpless. That type of cognitive shift had a huge impact, huge positive impact on Bill's mood moving forward. And when individuals feel empowered, when they know that they can take control in alternative ways, they are much more likely to be proactive and engaged in their self-care, which is going to help physical health, emotional health, and cognitive health. So we have to be very aware and very on top of these negative messages that we give to ourselves, because they stand in our way of living the best possible life. And the good news is they don't need to. I want everybody who's listening to practice identifying your own negative self-talk and crushing those thoughts like a bug, because you've got the power to do it. Okay. So what are some practical recommendations putting this all together? We know there are a lot of cognitive changes and challenges that individuals with Parkinson's experience. We know they vary in symptom presentation, and they vary in impact that they have on the course of an individual's day-to-day. We've talked about exercise. We've talked about good nutrition. We've talked about cognitive training, and we've talked about skills and techniques like goal setting, increasing involvement in meaningful and pleasurable and social activities, catching your negative thoughts and crushing them like a bug. So how can we put this all together in order to maintain optimal cognitive health? Okay. So first things first, always talk to your doctor. We want to make sure that Parkinson's medications are optimized. That's always the first place to start. We want to consult with professionals as appropriate. A neuropsychiatrist is a medical doctor that you can speak with who can help to prescribe and manage your medications. Sometimes there may also be medications that can be used to help enhance cognition, but sometimes it's about deprescribing. There may be medications that you're taking that are having a negative impact on your cognitive skills. And if we can get some of those medications out of your regimen, you may be thinking with greater ease. You may experience less cognitive impairment over time. There are neuropsychologists that you can speak with that could do some testing to help identify cognitive strengths and weaknesses, and then make some recommendations regarding targeted cognitive training or specific types of exercises that may be beneficial for you. But no matter who you speak with, we want to make sure that you're speaking with an individual, with a professional who has experience with Parkinson's disease, because that's really key. And again, I cannot overstate the importance of having your medications evaluated, especially if you're experiencing cognitive difficulties. We really want your doctor to look at everything that you're taking because some medications can have negative cognitive effects, and oftentimes they may not be as necessary as we think they are for other aspects of health. So if there's any medication that can be eliminated because of the negative effect it's having on cognition, that's a really important question for your doctor. So sometimes we need to add medication to help with cognition, but sometimes we need to take it away. Testing can be helpful, again, to establish cognitive areas of strength, as well as cognitive areas in need of more training and development. And then targeted recommendations can be made based on the results of those tests. We want to get moving. Any exercise is better than no exercise. Again, meeting with a Parkinson's-informed physical therapist to create a tailored plan can be incredibly helpful. Anything that you enjoy doing is the right thing to do, but we want to consider aerobic training and strength training, or yoga or dance or boxing, but pick something, start low, go slow, and try to increase your daily involvement with exercise. Think about healthy foods. Think about nutrition. Think about what you're putting on your plate. Try to avoid processed and fried foods. Eat more veggies, especially green leafy ones. Try to focus on nuts and berries and beans. Increase your uptake of whole grains. Try to get seafood on the dinner menu once or twice a week. And if you're cooking with oil or making salad dressings, consider olive oil instead of more processed vegetable oils. In terms of cognitive training, we want to stay engaged. Increase your uptake of puzzles and word searches and memory games. They should be reasonably difficult, not so hard that they're frustrating, but if it's easy, it's not helpful. So we want to engage in cognitive exercises that are at least moderately challenging. There are many brain games on the computer, and they can be adapted to your needs. And there are a lot of, very diverse experiences. You don't have to necessarily do brain games on the computer, but you can certainly find them. But crossword puzzles, mazes, like I mentioned earlier, playing cards, playing bridge, Sudoku, interacting with your grandkids, those are all really effective methods of cognitive training. Anything that you can do that challenges you to think more, to think differently, to think outside of the box is going to be really, really helpful. We want to remember that it's a part of Parkinson's to experience cognitive changes from time to time. So let's not judge ourselves for having some difficulties with memory or focus or concentration from time to time. Let's focus on what we can do to take charge and to increase our ability to deal with these symptoms as effectively as possible. We can seek help if we're feeling depressed or anxious. We can engage in hobbies that we find to be meaningful or rewarding or pleasurable or enjoyable. We want to stay socially active. We want to talk back to our negative thoughts. We don't want to just accept them as par for the course. See if you can increase your participation, relaxation, and breathing exercises. And we want to, big picture, focus on what you can do to take control over your cognitive abilities, because there are so many things that are within our control. We can exercise. We can make good choices with respect to our daily nutrition. We can challenge our brain. We can optimize our mood. We can engage with our friends and our family and our loved ones. We can incorporate and layer in different and diverse activities into the day-to-day. That's also really important. We don't want to do the same thing over and over again, but can we vary the exercise that we do? Can we vary the types of hobbies that we engage in? It can be as simple as watching different types of TV shows, listening to different types of music, walking in different parks in the neighborhood. The more variety, the better. Doing the same thing over and over again doesn't help us to strengthen our brain. Doing different things that also provide us with opportunities for challenge and meaning and reward and pleasure go a long way towards strengthening our brain and improving our quality of life. There are many, many tools at your disposal, and we want to use them all. So I want everybody to focus on what they can do to take control over their cognitive abilities. Nobody listening to this had any choice in the diagnosis of Parkinson's disease, but everybody has every choice in the coping response, and we want to go out there and do everything in our power to take back control and live the best possible life starting today. Okay, and I am going to end on that slide. My remote pickle just decided to stop working. So I'm going to turn it back to Chris. And thank you very much for having me and giving me the opportunity to chat with you this morning.
Well, thank you so much, Dr. Dobkin. I particularly appreciate that you've given us practical advice and specific actions that we can take to take charge in how we live well with this disease. I'll remind everyone that you can submit questions for Dr. Dobkin in the chat room. You'll find the chat room at the bottom of your screen, and the chat icon is the gray icon at the right end of the tray. So just move your cursor around on the screen. You should see that those icons appear at the bottom of your screen. We will take questions during our panel discussion later on in the program. For right now, we're going to take 15 minutes to allow you to refresh yourself and to visit our exhibitor room. You can click on the button on your screen to enter the hall. You must return to the main room at 10:30 to connect to the main program. You'll just click on that other tab to return. We will take some of Dr. Dobkin's keen advice upon your return into the main room, where we'll have a chance for each of us to get moving. So for now, if you'll go ahead and just as a little bit of housekeeping, the bathroom here is just down the hallway. You'll have to step over one of my dogs to get to it. I don't know how what the situation is at your house. It might be easier there. So we'll see you back in about 15 minutes. Thank you.